Nephrectomy, nephro equals kidney, ectomy equals removal, is the surgical removal of a kidney. The procedure is done to treat kidney cancer as well as other kidney diseases and injuries. Nephrectomy is also done to remove a healthy kidney from a donor, either living or deceased, for transplantation. A nephrostomy is an opening between the kidney and the skin. A nephrostomy tube is a thin plastic tube that is passed from the back, through the skin and then through the kidney, to the point where the urine collects. Its job is to temporarily drain the urine that is blocked. Nephrotomy is a surgical procedure wherein the kidney is incised. It is usually performed as part of a more extensive open surgery procedure, such as radial nephrolithotomy and anatrophic nephrolithotomy, among others, typically for the removal of urinary tract stones. Nephrolithotomy is a procedure used to remove kidney stones from the body when they can't pass on their own. Nephrectomy, partial. The physician removes a portion of the kidney. To access the kidney and ureter, the physician usually makes an incision in the skin of the flank, cuts the muscles, fat, and fascia overlying the kidney, and sometimes removes a portion of the 11th or 12th rib. After mobilizing the kidney and the major renal blood vessels, renal pedicle, the physician clamps the renal vessels. The physician excises a wedge containing the diseased or damaged kidney tissue. After clamping and ligating the exposed arteries and veins, the physician inserts a drain tube, bringing it out through a separate stab incision in the skin, removes the clamps, and performs a layered closure. Nephrectomy, including partial ureterectomy, any open approach including rib resection. The physician removes the kidney and upper ureter, but does not remove the adrenal gland, surrounding fatty tissue, or Gerota's fascia. After controlling bleeding, the physician irrigates the site with normal saline and places a drain tube, bringing it out through a separate stab incision in the skin. The physician removes the clamps and performs a layered closure. Nephrectomy with total ureterectomy and bladder cuff, through same incision. Through separate incision. The physician removes the kidney, ureter, and small cuff of the bladder through one excision. After mobilizing the kidney, ureter, and bladder, the physician clamps, ligates, and severs the ureter, major renal blood vessels, renal pedicle, and a small cuff of the bladder. The physician pulls the kidney, ureter, and bladder cuff upward through the flank incision. The physician does not remove the adrenal gland, surrounding fatty tissue, or Gerota's fascia. After controlling bleeding, the physician irrigates the site with normal saline and places a drain tube, bringing it out through a separate stab incision in the skin. The physician sutures and catheterizes the bladder, removes the clamps, and performs a layered closure. Nephrostomy, nephrotomy with drainage. The physician creates an opening from the kidney to the exterior of the body by making an incision in the kidney. Using an incision to open the renal pelvis, pyeloplasty, the physician passes a curved clamp into the renal pelvis, a middle or lower minor calyx, and the cortex of the kidney. The physician inserts a catheter tip through the same path as the clamp, and passes the tube through a stab incision in the skin of the flank. After suturing the incisions, the physician inserts a drain tube, bringing it out through a separate stab incision, and performs a layered closure. Nephrotomy, with exploration. The physician makes an incision in the kidney, nephrotomy, and sometimes places fine traction sutures at the edges of the incision. After exploration, the physician sutures the incision, inserts a drain tube, bringing it out through a separate stab incision, and performs a layered closure. Nephrolithotomy, removal of calculus. Secondary surgical operation for calculus. Complicated by congenital kidney abnormality. The physician isolates the calculus and removes it through an incision. After examining the kidney for other defects, the physician sutures the incision, inserts a drain tube, bringing it out through a separate stab incision, and performs a layered closure. Report 50,065 when a previous surgery on the kidney complicates the procedure. Pyelotomy, with drainage, pyeloplasty. The physician makes an incision in the renal pelvis to insert a pyeloplasty tube for drainage. After exposing the renal pelvis, the physician makes an incision in the renal pelvis, pyelotomy. The physician inserts the tip of a catheter into the renal pelvis and passes the tube out through a stab incision in the skin of the flank. The physician performs a layered closure. Pyelotomy, with removal of calculus, pyelolithotomy, pelvilithotomy, including coagulum pyelolithotomy. The physician removes stones, calculi, or an insoluble mass, coagulum, from the renal pelvis by making an incision into the renal pelvis. The physician makes an incision in the renal pelvis, pyelotomy, to isolate and remove the calculus. The physician irrigates the area and examines the renal pelvis for other defects. The physician inserts a drain tube, bringing it out through a separate stab incision, and performs a layered closure. Pyelotomy, complicated, e.g., secondary operation, congenital kidney abnormality. The physician makes an incision in the renal pelvis of a kidney complicated by a congenital abnormality or a previous surgery. The physician makes an incision in the renal pelvis, pyelotomy, and explores the calyces and renal pelvis. The physician may place fine traction sutures at the edges of the pyelotomy while exploring the calyces and renal pelvis or repairing defects. After closing the pyelotomy and nephrotomy, the physician inserts a drain tube, bringing it out through a separate stab incision, and performs a layered closure. Symphysiotomy for horseshoe kidney with or without pyeloplasty and/or other plastic procedure, unilateral or bilateral, one operation. The physician divides an abnormal union of the kidneys to correct a horseshoe kidney. To access the horseshoe kidney, the physician usually makes an incision in the skin of the lower abdomen and cuts the muscles, fat, and fascia overlying the kidney. After incising the union and placing 2 rows of sutures to control bleeding, the physician usually performs pyeloplasty or another plastic procedure on one or both sides of the divided kidney. After completion of repair, the physician may rotate the kidney to effect drainage. The physician irrigates the site with normal saline, places a drain tube, bringing it out through a separate stab incision in the skin, and performs a layered closure. Ureteroenterostomy, direct anastomosis of ureter to intestine. The physician connects the ureter to a segment of intestine to divert urine flow. To access the ureter and intestine, the physician makes an incision in the skin of the abdomen and cuts the corresponding muscles, fat, and fascia. The physician dissects the ureter, makes small incisions in the intestine segment, and surgically connects, anastomosis, the ureter to the intestine. To provide support during healing, the physician may insert a slender tube into the ureter. The physician inserts a drain tube and performs a layered closure.